News alert on COVID vaccine boosters. Meg Terrell, as always, has those details for us. Hey, Meg.
Hey, well, if a report that the FDA expects to have a plan for who should get booster shots by early September. This is according to reporting from the Wall Street Journal just now. The plan would lay out when and which vaccinated people should get follow-up shots. This, of course, as a lot of people who got the shots back in December and January, right after it was rolled out, are now many months into that vaccination. People who are 65 and older and those who are immunocompromised may need boosters, the Wall Street Journal reports, as soon as this month. This is according to two people familiar with discussions with the agency. So, guys, we have been waiting for a plan on what the U.S. is going to do on booster shots. But, of course, there are calls internationally for a moratorium, this from the World Health Organization yesterday, on boosters until at least September, so that countries that haven't been able to get access to the vaccine as much will be able to vaccinate some portion of their population. A lot of countries already going ahead making these plans for booster shots, guys.
Meg, I guess we still are waiting for a plan on booster shots, clearly, because this is just a timeline of when we might get a plan. Why are we still waiting? Is there suddenly going to be more data that it's worth waiting for, or are they just seemingly taking their time?
Well, they get asked this just about every time they put themselves out there for questions. And in fact, we're asked again today at the White House COVID briefing. And essentially what they say is they're following multiple sets of data to assess whether immunity is starting to wane. But of course, we know that in the immune-compromised population, they may need just a third dose in order to get initial immunity. And so that's one characterization. But they're also following data such as like what we heard from Pfizer last week, that there may be waning immunity even against severe disease after the 6-month point. And when you have folks who got vaccinated back in December and January, you really start to get to the point where you have to be considering if they need a booster dose. And so really just figuring out for whom to make the recommendations and based on what data, that sounds like what the agency is working on now.